I work for Magnolia Regional Medical Center. It is a 49-bed hospital in a small town in southwest Arkansas. I'm a nurse practitioner at the Rural Health Clinic, and we, as a hospital and a clinic, take care of a majority of Magnolia's population that is below poverty level. Our 340B community pharmacy partnerships are helping our patients by passing along savings they wouldn't have access to otherwise. Here in Magnolia, we are partnered with a family-owned pharmacy that's been opened in Magnolia since 1962. Without this partnership with the 340B pharmacy, my patients would have to travel further to get the medications that they need. When drug companies stop providing the 340B discounts, it directly affects the patients, pharmacies, and the providers. For example, I had a patient with type 2 diabetes as well as autoimmune issues. We'd started her on Jardiance. She was doing very well on it, no negative side effects, and it had brought her hemoglobin A1C down. She was receiving this medication through the 340B program, which was only costing her $16.43 a month. Unfortunately, after she went to go get a refill on her medication, she was given this information, basically saying that the company had pulled out of offering the discounts for that medication, and it was going to now cost her $556 for a 30-day supply of her Jardiance. After we discovered that the drug company was denying discounts on Jardiance, I had to bring the patient into the office. We had to discuss what options we had as far as medications go to help control her blood sugars. We had to try and pick a medication that was not going to interact with her other medications that she's on for her autoimmune issues. At that point, once we decided on a medication, we had to send it to the pharmacy and see if it was covered. And as usual, it wasn't. We had to do prior authorizations, which then delayed the patient getting the medication that she needed to control her blood glucose. If these drug companies continue to deny 340B discounts, they will potentially cause detrimental consequences to a population that's already struggling to make it day to day. It increases the risk of the patient having adverse effects, reactions, or negative outcomes because we're having to change the medications that have been working for them. I have patients come and sit in my office and cry when I'm able to tell them that they can get their medications and they can afford them and they don't have to give something else up, such as groceries. It gives them peace of mind so that they're not going to go without, and you just can't put a price on that.